Good evening, everyone, and welcome to our discussion on the National Commission to Address Racism in the Nursing Report. My name is Dr. Danielle McClain, and I am the founder, CEO, and president of DNPs of Color. Before we get started, just wanted to share that our mission and vision. And so our mission is to serve DNPs of color through networking, mentorship, and advocacy to increase diversity in doctoral studies, clinical practice, and leadership. Our vision is to inspire, empower, and transform the landscape of nursing to increase diversity in doctoral nursing practice.
This event is being hosted by the DNPs of Color, DEI, Anti-Racism, and Advocacy Advisory Committee. And I am one of the co-chairs, Dr. Vivian Pierce McDaniel.
And I'm the co-chair, Dr. Danielle McClain.
Hello, everyone. My name is Dr. Yvette Conyers. I am one of your session facilitators.
Hello, I'm Dr. Angel Daniels. I'm also one of your session facilitators.
Hello, my name is Chad Ricks. I'm one of the session facilitators as well.
And so I'd like to briefly go over our objectives for tonight. The first one is to discuss the National Commission to Address Racism in Nursing Report, to encourage participation in the call for public comments, and then to empower DNPs of color to be integral in discussions around racism in nursing.
And so for our purpose, the purpose of these sessions is to offer an opportunity for all to share thoughts, ideas, and reactions to the National Commission to Address Racism in Nursing Report. We also felt it is important to host this space to promote awareness and encourage your participation in providing feedback on the report to ANA. Please note that this is not a group venture. We encourage you to please go ahead to the ANA website and provide your personal thoughts and feedback.
So we want to create a lot of buzz on this event, so please be sure to use the hashtags. We did post them in the chat, but we'll give you a few seconds to either screenshot them or copy them from the chat.
Conversation and agreements. Please maintain an open-mindedness, listen and respect all points of view. Please let's have an indulgent acceptance and suspend judgment as best you can. Let's have a curiosity and seek to understand rather than persuade. And let's indulge in some discovery and question assumptions and look for new insights. Let's employ some sincerity and speak from your heart and personal experience. And the last but not least is have some brevity. Go for honesty and in depth, but don't go on and on. The Zoom forum guidelines are raise your hand to share a comment. Keep your responses under 45 seconds. Please mute. Camera is optional. Use the chat to comment. And at the end of the session, network by posting your social media handles and LinkedIn links.
So for session 2, we're going to review racism in nursing education with an overview of about 5 minutes, an open discussion for 25 minutes. And also we're going to review racism in nursing practice under the same session guidelines. And I'm going to turn it over to Dr. Yvette Conyers.
All right, so good evening again, everyone. My background is I am an educator, and so I think starting off the racism in nursing education is perfect. Last week, we had opportunity to talk about the history of racism just within regards to societal constructs. And so I would sort of like to open this up by just getting some of your sort of feedback on what you either thought about the history of racism in nursing education, or even in your experience, how it has played out so far. I know it's broad, but we're going to get more specific into this report. So I would like someone maybe to unmute or chat and share with me what has been your experience with racism in your nursing education as it continues today. Don't be too quiet tonight.
I would say, Dr. Cummings, one area of practice for me in nursing education, excuse me, has been leadership opportunities. Not having enough diversity in our leadership team, being able to get those positions on a fair basis. And that's one area that, is a struggle currently where I'm at, where I'm employed at.
For sure, Dr. Daniels. The report actually starts off talking about the history of racism. And so the nursing profession was created based on white women. It goes back to the early, 20th century, really breaking down how the nursing profession was created. And then ultimately how American Nurse Association did eventually invite us in the 1950s. That's only 60, 70 years ago. That's not a long, long time for us to be included. And so the report goes into more when you look at the didactic information that was taught in curriculum and is taught in textbooks and pictures of things, that a lot of the racism is played out in that. And so thank you for sharing your feedback so far, but others, what has been your experience dealing with racism in education? What have you seen? What have you challenged? What have you pushed back against? How are you advocating for the next generation of nursing students?
This is Ellen Malarkey. I just want to say that I totally agree with what's just been said, and I've heard other nurses complain about the same thing. But I've also seen it from patients. I've had I've been a nurse since '85, and I've had patients say that they don't want that Black nurse taking care of them. So then I just explained to them, well, there's no reason why he or she shouldn't, they're highly educated, they're good at their job, and that's who's going to take care of them today.
Thank you, Ellen, for sharing that comment. And during our second half too, we're going to talk a little bit more about the practice in the comments on that. But I noticed that too, that while I was reading the practice part of it, it was also sharing that, patients are saying, I want not a Black nurse, right? I want a white nurse. I think that speaks to, as well as letting it fall back into education, because as a Black nursing student, when you are with your clinical instructor or you with your other fellow classmates who are likely white, where's sort of that advocating taking place? How are you being included in conversations? If a patient does say, I don't want that Black student, which actually happened to me, was there anyone supporting me or saying, no, you're going to be taken care of by the student, whether you like it or not? Or was it we went ahead and made a way for the patient to sort of get what they wanted to? So that was just one experience I had, but Ellen, thank you for sharing. Others, any feedback?
I know for me, my experiences, sorry, this is Danielle. Just lack of opportunity. I know that I've had experiences where cohort mates were offered certain perks or were given, extra, I guess, intel on other opportunities to take advantage of, from like fellowships to different places to present, where I'm like, hey, how did you get this fellowship? And that was, $15,000, or I didn't realize we could present there now, so just having access to, I always call it the game book secrets, just being excluded in those ways.
Definitely, Danielle. Thank you for sharing that. I agree. The exclusion, I think, has been there for a while, even when you were a student. I think it continues as well. I know in my role in academia, I mentor a lot of students of color who I'm not necessarily their advisor, right? Or their assigned advisor, but they come to me because they feel something trusted. I think that speaks to more sort of the faculty role in academia, especially faculty of color, and that additional responsibility that's taken that they have to take on, but yet it's not taken into consideration, especially when you're going up for like tenure and promotion and things like that. I think a lot of the recommendations that did come out in terms of looking at redesigning nursing education is, again, what textbooks are we using, right? What guest speakers are we including? What do our PowerPoints look like, especially if we are talking about health assessment? Are we being inclusive of other skin tones, looking at conditions? But I want to hear from y'all. I want to hear from those who came tonight. So
Yeah,
what
three
are your
hands
thoughts?
up, Dr. Conyers. Yeah,
Thank
three
you.
hands up. Mhm.
I can't see them, so I
Uh,
apologize.
You want me to call them out for you?
Yes,
Okay.
that'll be great.
Chadwick, you were up first, and then Jessica, and then Sheila.
Yes, ma'am. I just wanted to make a comment. I am currently enrolled in my DNP program. And one of the things that I found to be offensive was you read about Florence Nightingale and the Crimean War and how she shaped the world of nursing and so on and so forth, but they never mentioned Mary Seacole. Mary Seacole was a nurse, a Jamaican British born nurse who helped Florence Nightingale at that time and subsequently went back to England to do some other things with nursing to help wounded veterans of that war and so on and so forth. Yet she was not given any credit. You find a little thing about her here and about there, but not a lot. So my whole point is, I think it starts with the textbooks, as she pointed out, that we're reading and that are being used in these colleges and universities.
Thank you, Chadwick.
Sheila Lightfoot.
Yes, ma'am. I'm currently working in academia, and I think for the aspect that most rings true for me is experience like advancing up the ladder. There's certain committees that they require you to serve on, and certain community service events that you have to log and track in order to be on, I say, in step with your professional progress. And I found that the opportunities aren't always offered, or when they are offered, you'll be told that someone else asked first, and that person would not necessarily be of color. It's like the advancement, the road to advancement is you almost have to be the last person in line to be able to get it, even though you're probably more passionate about it or even more qualified at sometimes. And I find that that those it puts you in a gray area, almost like you're hitting a glass ceiling and you can't go any further because the opportunities that are there aren't offered. It's kind of like a passive aggressiveness with that.
Thank you,
And
Sheila.
I've also run into that at professional organizations that I am a member of. If I attempt to run for a seat on the board or something like that, then they'll say that tenure has something to do with it or expertise has something to do with it. And I find that it happens in that area, in that arena, also in professional organizations. It's like a clique kind of thing. They promote their friends.
So definitely see the overlap in different areas of nursing. I think that also, again, speaks to, and you mentioned having a click or sort of tapping someone to be your successor, and you don't really even have a chance. Thank you, Sheila.
Hi, Celia McIntosh.
Hello. So I guess just listening to you guys, I had a couple things. So actually in school, I would say that I don't know if anyone experienced this, but oftentimes there were maybe some tokenism amongst the students of color, specific ones. Maybe there was a little bit of colorism, a little bit of, this person's lighter, they get treated differently. I think someone mentioned access to more information. But I think one thing that sticks out to me is that, because, if there were even like 6 of us in a class or in a graduating class, maybe not in the same room at the time, there would be not necessarily any real connection amongst each other. There would be kind of like this divide. Like, it was kind of like everyone knew their place. It's kind of weird. I don't know if I'm explaining it right, but it was kind of like the house ones versus the outside ones. It was kind of like we're in this program together, but yet we're still disconnected. We're not seeking each other out to study together, to support each other. I noticed that quite a bit. So even within our own group, it was that disconnection. Or you could go the whole 2 years in a program, someone in your graduating class, and you never knew this person. You sat by them, or they sat in the room with you, but you didn't know them. So it was just kind of, even if they look like you, there was just this automatic, division. So that was kind of what stood out to me, or kind of strange. In terms of, how you would be treated, the tolerance for you was less. Things that they would put up with from other students, with you, it was pretty much less. The expectation for you to succeed was different. When I was in school, especially my first degree, it would be that idea of, people would say, oh, they're trying to weed you out, that weed out mentality. And it would look like it was just a blanket for everybody. So you just kind of thought it was that. You didn't necessarily think it was because of race. But that kind of stuck out a little bit more. And, some people, not that this happened to me directly, if you were too smart, then you were cheating. So it would be that kind of attitude. But those are some of the things. But definitely lack of support if, I think I posted something about this, a little while ago, talking about, even in when you get into the workplace, now you're still used to only seeing you, or, it being you. So it also becomes kind of normalized, in a sense that, okay, well, this is kind of what it is, so you don't really understand that there are gatekeepers to nurses of color getting in, because you see, it's either you or one other or a few other. So it's like, okay, well, maybe they're not trying as hard. So now you think you take on that kind of mentality or that thought process, like, okay, well, maybe they're just not trying as hard, I guess. And maybe they just couldn't get in, or, was there something special about me? You know what I'm saying? So it's just a variety of those things that came to my mind as you guys were speaking. So I'm done speaking.
Thank you. I just wanted to just be mindful of the conversational agreements, and we have some hands up. So we want to give everyone an opportunity to share and also discuss the report. Thank you.
Thank you. Thank you, Dr. McIntosh, for sharing your thoughts. You got the chat going with quite a bit. Thank you. Keshi, hopefully I'm saying that right. Please correct me.
You said it perfectly. Thank you for having me. This is my first time joining you guys. I'm happy to be here. One of the things, I'll just say something very recent, because I think all of us have experienced this, but it is our, what happens with our students, when when they are in the clinical setting, because the experiences of biases, discrimination, limited opportunities, or even the withholding of information doesn't always just come from, other students. It's from the clinical people, the nurses that they interact with in the clinical setting, right? So because nursing education, most institutions are having some difficulties finding clinical placement. So they allow the nurses, and sometimes in the nurses' aides, in these settings to oppress, and I'm using that word correctly, to oppress their, Black and brown students in clinical settings. So they treat them poorly, they withhold information from them, they report them for no reason, because that's the way I will address it, for no reason or for minor mistakes that you will expect students to make while you're with them and correcting that, instead of correcting those mistakes or working through those things with students, they hold on to them, they make very little things into these big issues that they place the students at risk for failing. When in front of those students, they will ignore or pander to the white students who are also in these settings with the Black and brown students. So those things, it's our method of socializing our students.
Yeah.
So you can imagine what kind of message that is setting. It says to the white students, it's okay, you can make mistakes. We here, we got your back. You Black student or brown student, I'm gonna make sure, because you did not wait for the alcohol prep to dry on the patient's skin, that you failed this course because you didn't do that. So some of those things we ignore sometimes, or we pay less attention to, or because we are afraid to confront the clinical settings, we fail to address those issues when the students are being oppressed in the clinical setting.
Thank you, Kashi. You said a lot, completely agree. I think many of us have been in those shoes, and if we are faculty teaching or clinical instructors, we see that as well. Thank you. Tammy, and then Jessica.
Hi, good evening. This is the first time that I've attended, so thank you for having this. I think one of the big things that I have run into is for me to slow down when attempting to climb the clinical ladder, and then I will find people who have a lot less experience than me, a lot less education than me, being promoted to those positions. I'm being told to, oh, hold on, take a breath, slow down, take it in steps, be a manager, then be a director, then maybe you can be a CNO. But then I'm finding people with 3 and 4 years of nursing experience compared to my 30 being driven directly into a director's role. And I'm also going to expound upon how I wind up getting my DNP, going to earn my DNP, which I just finished the program in December. Was I was completing my master's, and we were having a roundtable conversation, and my instructor said to a girl who's white, oh, you would be perfect to go into a DNP program. And when I said, I've been thinking about that, and my instructor turned to me and said, you know what, you just don't seem to be DNP material. And that just drove me to be like, you know what, I don't fit into your box. I don't want to fit into your box. And I'm going to show you I don't have to fit into your box. So I think the vision for, one thing that you said to me that's just ringing with me is that the profession of nursing was made for white women. And you can tell by the problems, the cliques that are there, who has been promoted, who has been driving, leadership. It's all about their friends. And, I'm looking for my next leadership job and just hoping that someone will take a chance on me, where the person next to me, if she's white, that she's going to get that opportunity. And that's heartbreaking.
Thank you, Tammy. And I think in the report, it goes more into detail about there has to be levels to this, and it has to be driven by leadership. Leadership has to be at the support of supporting the nursing students and their faculty and staff in the academia setting in order for there to really bring about change and have health equity. Jessica, we'll take your last comment before we sort of wrap up the education piece.
Thank you. Good evening. My name's Jessica Lamberson, and I am an assistant professor at a university in the Chicagoland area. I just finished my DNP last May, and 3 quick points that I wanted to share, or experiences that elaborate on what other people have shared, is one, the concept of racism as a risk factor was not introduced in any of my nursing curriculum until my DNP program. So that is a problem, and that is something that I've been challenged to do, to integrate in some of the clinicals. I've taught obstetric clinicals, OB, labor and delivery, as well as master's course content that I've started teaching this year. Secondly, I'm going to lose my train of thought. Being hired as the only full-time tenure track faculty of color. Stepping into this new role, I welcome the role, but I'm also leery of what to anticipate and expect. It's a small faculty, and I've had some history there as an adjunct, so I know some of the faculty, but pushing back and challenging some of the assumptions and the lack of history, as Chad had shared, the lack of history that is shared in our nursing courses from bachelor's through the DNP program we're going to start this fall. So those are two things that I appreciate this group and this conversation for, to help provide some information moving forward as faculty without other faculty of color in the nursing faculty.
Thank you, Jessica, for sharing. And I think it's important, and Dr. Daniels put this, and so a call to action in the report is that, academic leaders and organizations look beyond that whole DEI role, diversity, equity, inclusion officer or role, and really look at equality. So even as you're entering, your next season, whatever you decide, even if there isn't a role for a DEI officer at your position, what are others doing to create a space that makes you feel inclusive and like you belong, which was other information that stood out. And so the report definitely has some recommendations for things to move forward that I would encourage everyone to continue to take a look at. And at this time, we will transition to the practice.
Thank you. Thank you. Can everyone hear me?
Yes, we can.
Okay, good. I'm gonna make sure I wasn't on mute. So again, my name is Chad Ricks. I'm currently a director of clinical operations for a large hospital system in the West. And one of the things that I found in this report to be spot on, as they say, was about racism in practice. And so, and practice can mean a lot of different things. It's a broad word. You can mean at the bedside, you could mean in administration, clinical informatics, operations. It could go on and on and on. So I'm going to talk a little bit about that, and I want to spark some conversation on what that means to you and many of us in actual practice. One of the things the report pointed out that caught my attention, and that I often mentor young Black professional nurses about, is how to handle our emotions. And this report talks about nurse leaders in positions that should address racism, bullying, and incivility and discrimination from peers and patients, and offering some sort of tools to use when confronted with microaggressions or such bullying. Can anyone here talk to me about what microaggression means to you? I ask that question only because people have a different definition of what a microaggression is, and some don't really know what microaggression is or fail to recognize it. So please, somebody jump in the conversation, tell me what your thoughts are, and let's have that discussion.
We have a hand up, Sheila.
If I were to characterize a microaggression, I would say that it's a passive aggressive type of behavior of refusing to help and being of assistance to a certain person or group of people due to an implicit bias that they have.
Okay, that's great. Anyone else?
Someone in the chat said, Alyssa, refusing to help, withholding information. I had said, insults that occur to bias. Catchy. I don't use microaggression. I use the term racial microaggression or racial assault.
Okay. Absolutely. So viewing that, and those are pretty good, great definitions. Someone used the word earlier. They said passive aggressive. Sometimes our counterparts are not as quote unquote aggressive as they think we are, and they use the passive aggressive approach. So answering what microaggressions are, how does that make you feel? If you've ever experienced that, tell me to this group, what that makes you feel like. What feelings or emotions come to mind when you feel like you've been downplayed or dismissed or anything of that nature? What are your thoughts on it? And I'm getting to a specific point that I'm going to point out here in just a second, but I want to know some thoughts on that. What are the feelings or emotions that come to mind?
Amanda?
Oh, thank you. So for me, I think one experience that stands out in my mind was about 10 years ago. I had a fellow faculty member turn to me and say, so as a minority student, what kind of resources did your nursing school have to provide to ensure that you were successful? And my first reaction was offended. Second reaction was just anger. And the anger that I felt wasn't necessarily to the fact that she thought I couldn't cut it, but it was more to the fact that I thought if another student looked like me walked into her classroom, she would automatically assume they can't cut it. And that's why for me, it just sparked the anger, because she was projecting onto all these students that were going to be coming into her classroom. And I just thought that is such a sad statement. And it wasn't until years later that I was able to put kind of a term to it, because, now DEI is a hot topic, and microaggressions, we've heard about that. But back then, 10 years ago, I didn't know exactly what to call it, but it was a snub, it was an insult, and it was definitely, due to bias.
Absolutely. Thank you for that. I appreciate it. Anyone else?
Sheila?
Yeah, I can remember the first thing was shock. I was really shocked because this was at first my peer and now my leader. And when I say leader, I say that you expect a certain level of professionalism from them. And then the second emotion was disappointment, because she's in a position of leadership, and I feel like she should be held to a certain expectation and not to fall prey to those types of things, and to be able to keep her emotions in check. And it was an emotional type of statement she made to me. And so shock first, I would say, and then after that, disappointment to see a leader act and behave in that manner.
Is there anyone else?
Yes, Dr. Campbell.
Okay.
Hi, good evening. I would probably say it depends on, I'm just speaking for myself. I think that I've experienced microaggressions at various points in times in my nursing profession. And I would say at each of those time frames, I was either ignorant to the fact and dismissed it. As I matured and understood what it was, then I became angry. But then as I became more thoughtful and understanding and more insightful, I became empowered, right? So I think that you go through these various stages based on your personal experience and based on your ability to have that emotional intelligence. And then I think being in the right space of empowerment to be able to identify it and address it intentionally, to know that you have the power to kind of stop it in its tracks. So I think it all depends on where you are with your maturity level.
Well, Dr. Campbell, thank you for that. Is there anyone else?
No other hands, but there were some good comments in the chat. Feelings of anger, shame, sense of invisibility, feeling unheard and misunderstood were a few. And sometimes it just makes you feel like it's all in your head.
Right. So I'm gonna address two things here. One, let me go back to what Dr. Campbell just said. You used one of my favorite words, emotional intelligence. As I mentor young African-American nurses and leaders, this is a big deal. We have to learn what emotional intelligence is. And it is up to us who are in these senior leadership positions or leadership positions, period, to take these young Black professionals and to talk to them about political acumen and to talk to them about emotional intelligence and what that means. I mentor someone now, and he's going through what he's going through in leadership. And he said, well, how did you make it to where you are? And what did you do to get there? And how did you handle microaggression? And how did you do this? And how did you do that? And he's angry. And I said, well, first of all, we can't be angry. We got to get those emotions under control. Now, I'm not saying, I don't want to confuse that with meaning you don't have a right to be angry. That's not what I'm saying. That's a normal, rational emotion. But how we display that emotion is totally something different. So we talked about emotional intelligence and what that is and what it means, because it brings self-awareness. When you bring self-awareness to something like that, then you can develop the tools to combat that. I agree with you about maturity, but it is those of us who are more mature in the profession, whether in age or in profession, to teach these young people how to do this as African-American and brown professionals, because this is where we struggle. The report states that microaggressions such as bullying, which result from the study they found in lower self-esteem, high anxiety, many levels of depression, fear, and isolation if not addressed. Isn't that something? And some of you have experienced and expressed some of that tonight, and you wrestle with this for years. So hopefully this conversation will teach us and address how do we handle these things? How do we address them appropriately? And I'll get into that in just a moment, but I'm just curious, anybody have a comment on that?
Ellen has her hand up.
When I was a young nurse working in ICU, I went to an assertiveness training class, and they had this little statement that you should say. So when a physician, for example, comes in and is upset and angry at you, you say to them, and when you can do this with, the person with the microaggression, I understand you're upset about X, Y, and Z, but it's inappropriate, uncalled for, and unprofessional for you to talk to me like that. And please don't do it again. From that time on, wherever I worked and used that line was perfect. So, and the person who led this assertiveness training class said, rehearse this in front of the mirror, because you're going to be flustered when you need it. And if you rehearse it and you get it down pat, then when you need it, you can step out of the room, take a deep breath, step back in the room and use it. So.
Absolutely great comment. And that is absolutely correct. It is not good to talk when you are emotionally upset, even if it's got to take you 30 seconds to take a deep breath. This is why emotional intelligence is so very important. I thought I saw another hand up. Did I see another hand up?
I think somebody did have their hand up, but they lowered the hand. Anybody else have a comment to share?
I was just clapping at what Ellen said, and I think I'm going to write down that statement, because that seems to me like it would diffuse and it would open up the conversation, open up for a conversation, actual conversation, instead of getting the slight remarks or the angry expressions. So I'm going to write that down. Thank you, Ellen, for sharing it.
That is a great comment. Yes, Dr. Campbell, go ahead.
I was just going to add another strategy that I use is to have that person to repeat what I thought that they said, right? Because then it gives me an opportunity to not put my own assumptions and my own interpretation or other individuals' experience that I've had in the past. It allows me to kind of calm down, have a moment of clarity so that I can understand exactly what they intended to say. But it also gives that person an opportunity to hear themselves say what they have just said. So I think that is another strategy or technique to try to diffuse the situation.
I totally agree with that. I grew up down south, and I say the old people, not disrespectfully, but the elders would say you have to show people how embarrassed they look, how embarrassing they look. And so one of the tools that I've developed personally is and you do have that, you have people come at you, cross-eyed and crazy, so to speak. You have to say, excuse me, I'm sorry, there appears to be a problem, and I'm just trying to understand what it is so we can get clarity and move on. Can you help me understand where you're coming from? And then when you do that, you're right. People take a step back and say, Oh, well, I was saying, you know, X, Y, Z. Okay, I just want to be sure we're clear because it appears that you're aggravated and I don't want to aggravate you. So that I need to be clear about what you're saying to me so that we can communicate effectively. Therein lies the political acumen, so to speak, and the emotional intelligence. And that is a phenomenal tool. And you are absolutely correct. And I use it all the time. It is a tool to deflect and turn it into reflection back on the person that has come at you in an unprofessional or sometimes downright hateful manner. Does anybody else have any other ideas regarding this type of interaction?
Can I just add, I feel like these techniques should be taught in school. So we talked about education, now we're talking about practice. It's across to me, like, yes, I want to be able to do these things in practice, but for me, if I'm learning them as a student or if I'm able to teach them as a student, it's ultimately just going to prepare a better workforce, a better nursing workforce. And so I think if these techniques can be incorporated in simulation, in the classroom, in your lab, in your clinical groups, all realms of education, it can lead to a better practice.
Absolutely.
Environment.
And I think for you that are educators, and I'm not by any means trying to tell you how to do your job because you're the experts, but I think talking about this in your clinicals and in your classrooms, talking about racism, talking about the influence that it has on healthcare, and the need for the nurse to be cognizant of this. You know, we talk about cultural bias all over the place and inclusivity. And I'm here to tell you, inclusivity doesn't mean that always includes you. So let's be clear on that, because people got different ideas of what inclusivity is. But I think it is important for us to teach about, not only about, but the impact of disruptive behavior and things that disrupt harmony and good working relationships, because that, after all, that's what helps us do what we do best. Is an interpersonal relationship with our colleagues to be able to do the best for our patients. So there's some comments in the chat. I just wanted to, I don't want to miss anybody.
Can I just make a comment? This is Danielle. I just wanted to bring it back to the document and just talk about policy, because as I'm learning and growing and educating myself, we can't move mountains without changing policy. So I thought it was interesting that some of the points that they brought out was looking at implementing operational definitions related to the issues and meaningful to the setting committed to dismantling racism, setting up organizational plans with buy-in from leadership, staff, and employees with built-in accountability for outcomes, establishing DEI as a programmatic approach with the line item in the organizational budget to make the work sustainable. And a lot of us have witnessed with the onset of COVID and then the racial reckoning that we're experiencing is that all these major companies are wanting to put DEI at the forefront, but a lot of it has been superficial. So there hasn't been any action in place to put in some of these policies that truly dismantle racist practices that perpetuate the oppression and suppression. So I thought it was interesting that they highlighted that, but then also just have a discussion around the policy piece. If anyone have anything to offer in regards to that. I know I see some policy heads in there, namely Dr. Ferreira, Dr. Pierce McDaniel. So if you guys have any comments, since you guys are heavily in policy.
Anyone else, feel free to jump into if they're not available right now.
Well, I think, this is Chad, I think it is important to have this conversation within your organization. I have had those conversations from time to time. And one of the things that we've talked about is what inclusivity and equity means. Again, I only say that because people have a different definition of what that means. So we got to be clear on what we're talking about. That's one. And number two, asking senior leadership in the acute care setting to hold their feet to the fire if they're committed to this and ask what they're doing about it. Are we recruiting more multicultural people? Are we actively recruiting and retaining what we do have? And then if we are, what are our metrics? I agree with Dr. McCamey. She said a lot of people are, everybody, the DE word, the buzzword is DE&I right now because of what the country's gone through the last 24 months. But I'm always, I don't want to say I'm leery, because I don't want to be negative, but I always have to wonder, what actually are we doing about this to bring about some equity and some inclusion? And so one of the things I've asked is that we have a council of diverse backgrounds and diverse views so that we can address inclusivity of our patient population and sensitivity to our patient population. And it has been successful to some degree. Now, I don't know on a system scale, I'm just talking about in the facility that I'm currently in, we're actively doing that. And it has appeared to make some sort of a difference. Now, mind you, I'm the only African-American leader in this organization at this moment, and I'm doing everything I can to change that. I'm asking HR leadership to let's recruit, and let's do our best to be diverse in our recruiting methods, and let's talk about how we're doing that and how we can help you do that. So those, I agree with Dr. Kim. Those are the conversations we should be having. That this is in the report as well. Yes, ma'am.
We have two hands up. Madeline and then Stephen.
Thank you, Dr. Daniels. Good evening, everyone. I apologize for my late arrival. Work, life of a nurse. My comment on policy and having these conversations on the diversification of these committees and whatnot, and having dialogue with my colleagues at neighboring institutions. It seems as though the focus of diversifying the workforce is at the medicine level, so at the physician level, and not as much attention is being given to this commission report, or even earlier early last year, I apologize, on the new Institute of Medicine report. And so as nursing colleagues from different institutions, we are struggling to bring the importance of diversifying nursing as well as our physician colleagues. And so I think that's an important component as well to bring to the table when we are having these conversations with human resources. It's not enough to just say we need to diversify the workforce, but specifically every single piece of the workforce needs to have representation.
Thank you, Stephen.
Thank you for the conversation and the comments. I know that from a policy perspective, and I do a lot of policy work, nursing organizations have not been the best friends to people of color. And I understand why people have decided to stay away from some organizations. And I certainly personally don't blame anyone. But I also believe that the work has to get done and we can't ignore it. And I don't think it's fair that we have to do more work to bring these issues forward. But I live under the adage, if not me, then who? So, I think it is from getting involved at the organization level, getting involved at your institution. There's really nothing stopping any of us right now to have these little groups at our institutions where we work to talk about this very thing that we're talking about tonight. Doesn't have to be fancy. So, I have in my career not waited for other people to kind of look for solutions. I think we have to look within. And again, I don't want this to sound like, you know, it's incumbent upon us to do this work and we have to work extra hard to do it. But again, I think it's an opportunity for us. And, you know, you try and you may not succeed, but you try again and you may not succeed. And at some point you have to say, right, this is not going to work in this institution, or this is not going to work in this organization. And I have to take a good hard look and say, is this the right place for me to be? And if not, then perhaps you need to move on to an organization that is certainly more in alignment with what your values are. So thank you so much for the opportunity to comment.
Thank you. We have some great conversation going on in the chat. A couple of comments is talking about that I really don't see it put into action. Schools and hospitals all stating they have DEI programs, but I do not see it placed in action. Adding DEI statements to specific documents to look like you're taking action pretty much. There was some thought around, there are some efforts in the area of nursing diversification, but it is slow. And then another great question, what is the role from a policy standpoint for accrediting bodies? That is a great question. Any thoughts when we talk about accrediting bodies?
I have a comment. This is sketchy. A colleague of mine and I wrote a paper. I think it was published last year. I can't keep track anymore. And that was one of the very first papers that questioned the role of accrediting bodies on addressing racism and inequities in the nursing profession. Because as some of you mentioned, you know, we talk about DEI, right? Diversity, equity, and inclusion. And sometimes the work is focused on diversity, which is just counting the numbers, right? Oh, well, you know, this year we increased our non-white students by 15%, right? So everybody applauds and pat themselves on the back and they move on. What everybody forgets is, what about the equity and the inclusion part of it, correct? So we've talked about people not being represented in the leadership or on the board or even the committees where the decisions and the policy decisions are being made within our institutions, because maybe somebody tells you you've only been here 2 years, you have to be here 6 years before you can consider being in this committee where the decisions and the policies are being created. So that is the question, you know, so who is measuring, who is accountable, who is holding our institutions, our hospitals, our places of work, and our institutions accountable for the inclusion and equity part of this DEI? How are we measuring it? Because we know we can count, yes, every year or every 2 years, the number of students of color who got admitted into nursing programs are published. What they don't publish is the percentage of those students who actually graduated. So the question is, why are we not measuring how many of them graduate? Is it because we increase the admission by 15% and we graduate only 10% of that 15% that we brought in, right? So we admit 1,000 students across the country who are not white, but we graduate only 10% of those 1,000 students. That is not equity and inclusion, because it's not the increase in the numbers. Increase in numbers are good because then it releases the isolation that people feel when they are the one and only be in their institutions. You could see somebody else who looks like you, who sounds like you, who dresses like you perhaps, so that you don't feel so alone. But the point is what is being done. How are we accounting for those things? So unless there is a way for the organizations, especially the accrediting bodies, to hold the institutions accountable. We are going to be having this conversation over and over again. But the other thing is, when we are in these meetings, we need to speak up. When we have them bring up where there is no money, well, we have all these students, they need help, but we can't afford tutors, or there are no tutors. Are you sure there are no tutors? Or because you don't want to pay the money to have the tutors to help the students? So what about, financial aid or, scholarships that are usually available at institutions, but they usually don't tell other, the minority students about it? So these are some of the areas that we have to look at. We all have a role to play, but also we have to hold our institutions accountable when we are when these things are happening, because unless we address the equity and inclusion part of it, we are going to be admitting more students and they are not going to complete the programs. Or we are going to hire more people of color in our institutions, and they're going to keep leaving because they are not being included, within the institution. They're not going to feel like they belong. So I think that's a great question. So what are we going to do about it? But the other point I want to make is, we are not solely responsible for addressing this problem, right? We like to talk about resilience. It's always the, emotional labor for Black nurses to address these issues. There are limited numbers of us. Our white colleagues need to also embrace this action. So how do we get them to embrace the action and not just talk about it? And it's by challenging them when they bring up this, inequitable conversations, the conversation that everybody nods their head to, and we know it's wrong. We need to speak up and challenge those things.
Thank you so much. We have one more hand, Lexi.
And I wanted to add on to what Kechi said, in that I'm at the VA hospital, and that is correct. When we have meetings with the chief in primary care, what happens is that right now we currently have one Black provider who is in leadership. And that was after I started writing emails and started speaking up at the meetings. However, they asked what it is that we wanted to talk about and what was the most pressing issue. And everybody complains on a regular basis, stating that we have a lot of nurse practitioners who have been at the VA, who are Black and who's been in positions working hard day and night for over 9 years, and not one of them have been promoted. Yet they do not meet the proficiency and are not promoted because they've not been given an opportunity to either practice in leadership roles or even get an opportunity to function in anything. And so the white nurse practitioners, they would come in, and within 3 to 6 months, they are automatically promoted into leadership positions. And if we precept them, once we've finished with that preceptorship, they're automatically promoted and we remain where we are. So we had another big meeting, a reboot meeting, and we met for 2 days straight. And the chief of primary care asked me what was my thoughts. And so I gave him my thoughts in a respectable way. And I said that I would like to see more brown people at the leadership table instead of outside in the hallway. And he told me in no uncertain terms that I am walking around like I'm entitled to something. And I told him no. And he said that I was very abrasive and very hostile and very aggressive. And I said, I don't take any of those words because they do not define me. That's your perception. And I do wish you would actually take the time to learn more about my culture. I'm educated, and that's not the way you define an educated woman. And since then, I have been blacklisted, and my panel suddenly increased to having the most patients in primary care and psychiatric as well. So I'm taking the heat for this, and I still don't have anyone backing me. Everybody has suddenly backed down because they don't want any retaliatory behaviors. And so they're like, okay, Lexi, you better leave it alone because you've already been blacklisted. So just come into work and go home and don't say anything. And I want to know why does it have to be this way? Because it's actually 2020. I was not aware it was this bad inside the VA. I was not aware that the discrimination and the racism was this deeply wedged inside of the VA. And it's disheartening to see that in such a profession where compassion and dedication is at the core of nursing, that we've come to this. Thank you so much for allowing me to speak.
Thank you so much for sharing. We had some good comments in the chat. You know, allyship, talking about the allyship accountability, as mentioned with Dr. Kiki, just talking about being, you know, uncomfortable and having those uncomfortable conversations and actions and having the voice heard. You know, great opportunities. Structural racism was endorsed by the federal government. So just wanted to share a few of the comments that were in the chat.
Lexi, you know, you said a lot in what you were saying. You can definitely hear, you know, the, you know, not necessarily the passion, but just the emotion behind your experience and what you have encountered. So thank you for sharing your thoughts tonight, and everyone, for sure. One of the other things I just wanted to point out quickly too from the report is, you know, as we talk about practice and as we talk about limited numbers of people of color, but ensuring that, you know, that workforce transition. So who are we talking to try to get them into the workforce of nursing? Are we talking to middle schoolers? Are we talking to high schoolers? Are we talking to LPNs, talking to associate degree prepared RNs to go higher in their education, and so that they can be able to be leaders within the organizations to help ensure some of this change as well is happening? Not that it should just be on BIPOC people, it should definitely be on white people, you know, for allyship and being anti-racist, but also thinking about how we can encourage each other, those in our network, to keep going as well. And then Kechi just put in the chat, you know, structural racism was endorsed by the federal government, Supreme Court of the US. And just a comment to you, Lexi, from Kechi about keeping a journal of those interactions and exchanges. I think that's a good tip for many of us, actually. Thank you. Chadwick?
Yes, well, last but not least, I want to talk about really briefly some recommendation here, some recommendations that the report brought out. And it just really talks about how we approach these different things. It talks about workforce recruitment, which we kind of mentioned, retention, and career progress, mentoring. Many times we don't see leaders who look like us, so it's hard to get mentorship going, but we should all individually and collectively try to do that. Some of the other things it brought up, going back to microaggression and incivility, is when we are present, if we are present, that we address that behavior immediately, and because it's considered a disruptive behavior, and talk about how uncomfortable it is, and what we can do to create a better understanding. Those are some of the things that the report brings out, as well as other things. Those are just a couple. It does help to talk about these feelings, as they pointed out just a few seconds ago. Journaling, talking to HR about it, if there's a need, and then talking about it in a group setting when something is uncomfortable, to help people understand that they've made you feel uncomfortable, and that it needs to be addressed.
We have about 9 minutes. This officially ends at 8:15. If anyone else would like to chat or share anything else.
Celia raised her hand.
McIntosh?
Yes.
Real quick. And I also want to, I guess, emphasize getting out, having an exit strategy, because after a while, this wears away at your confidence. It just erodes you as a person to be in these environments over and over. And for you at the end of the day to save your sanity, sometimes you just have to get out.
I think that is very important. I think many times we may stay in positions or in situations or organizations because of, fear of, what we're going to do next with our lives and where we're going to go, and maybe even fear of feedback of what people are going to say. But you're right, for our own sanity, our own mental health, our own, stress, prevention of other diseases due to a lot of the stress, it is important that we're able to make those sound judgments.
Lexi, you had your hand up.
Well, I do a lot of mentoring to LPNs and the RNs here, both Black and white, Hispanic, and the African nurses. I do a lot of recognition ceremonies for them, and we do a lot of after work training so that they can get into positions and get better, and also so that they too can train others and bring them up and, get the profession in a bigger and better place. So that's one of my things that I've always done since I got into nursing 35 years ago. So I love doing it. So that's one of my things.
All right, just a couple of things in the chat. The financial cost of racism that no one talks about is having to leave your job due to racial assault and having to start over.
Mm-hmm.
Any other comments or questions you want to add before we start to wrap up?
I wanted to say something, and it's asking a lot, but it always gives me joy when I see these kinds of forum where you're not alone, right? Because we are also very busy trying to make a living, trying to do this work, often underappreciated, in our places of work where we spend most of our days. The other thing that I would really love to see, I just love this forum here. I hope we make it something of a membership type of thing with all the other benefits that comes with being a member of an organization such as this one. But what this kinds of forum does, besides providing emotional support and knowing you're not alone, is providing that opportunity for leadership in organizations, providing opportunities for awards, recognitions that goes into people's CVs, so that if your employer doesn't want to recognize you, then we will recognize you at a national level, because this organization is a national organization if we make it formal. Because what it does is gives opportunity to people who wouldn't, have it. And I know many of you here are educators. I want to also say that the Association of Black Nurse Faculty offer a lot of some of these things. They also, when you go up for tenure, some of these organizations that have been around for a while that I recognize are also places where you can find support. I think that, when I discovered Association of Black Nurse Faculty, they saved my career as an educator. Every time I attend any of the meetings or conferences, I live there and I'm floating, and I float for like a month or two before all the other experiences begin to, clip my wings. And I'm always looking forward to the next time, because when you know there are people like you who are trailblazers, who you could call on anytime, it is very helpful. So I'm very, very happy to see this here, what you guys have started. And I hope that, one important thing is we have to make it affordable because sometimes that's what scares people away, is that they look at the cost and they're like, forget it, I'm not doing this. So because there's a lot that can be done virtually now, people don't have to always spend all that money to be in one space, even though that's important.
Thank you, Kechi. I think, you're highlighting too, again, the continued need for us to have a sense of belonging. This space was created for us to do so. I'm sure Dr. McCamey will continue to, lead efforts around this. I am not a member of Association of Black Nursing Faculty. I should be, you're right. I like to join organizations I can be active in. And so, I pay my dues, but I want to be active in those things as well. But thanks for sharing your experience with it. And I may re-look into it as well. I think their conference is in Bahamas this year, actually. We'll see. Chadwick, anything else before we sort of wrap up, or Dr. Daniels?
No, I think we've had a great discussion, and I really enjoyed the interaction, and I hope we can keep these conversations going amongst ourselves as well as outside in the communities we serve.
Yes, thank you all for your engagement, for coming, for joining, for listening, to sharing. We really appreciate and love that you all are here tonight with us. And with that, I'll turn it over to Dr. McCain.
I'll just hop in 1 minute, my apologies. So just a reminder, please submit your feedback. So these forums are not meant to take your feedback and submit them to ANA. We encourage you to reach out. Here's the information here. It's been put into the chat a couple of times as well. Please, please, please leave your comments for the 2022 National Commission to Address Racism in Nursing report.
And I want to piggyback on that. I read the email today. I think it's open until the 14th. So please, 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 please go and make your comments known to the association. Thank you.
All right, thank you everyone for coming out tonight. We do have another discussion session tomorrow, so we hope that we see you all again tomorrow. This session will be recorded and uploaded to our YouTube channel. And please be sure to follow us on DNPs of Color. We're on all the major social media outlets, and you can go to our website, www.dnpsofcolor.org. Thank you all and have a wonderful evening.
Everyone, good night.
Hello, everyone.
We're just waiting for everyone to leave.
Now I have to go. My student is coming back on. I just wanted to say it was wonderful. I could hear some of it, not everything, and but it was wonderful. I love Kechi. She and I have talked a few times, and I thought this one was really, really good. I could hear most of it, but I kept having to go in and out with the student. So just wanted to share that with you. And I'm going to go back to my student who was having technical difficulties. I'll see you guys.
Thank you.
Bye.
All right.
Thank you.
Bye-bye.
All right, excellent work. Any debriefing thoughts, stuff we can do better, stuff that went well?
Sorry, that's my dog, y'all. These reports have so much in them. And although I review it ahead of time, I have it here because on the screen, and I feel like we can take one report and spend 3 sessions on it, if we really time to broke it down. And I know we're at a higher level and I'm appreciative of what we're able to accomplish, but they're heavy. And you mentioned that, you said that in your initial email.
It brought out a lot of emotion to people. You could see, and that's why I asked some of the questions I asked, because it brought out, you heard some anger, some despair, some depression, some fear, some self-doubt,